All right, I will be starting the meeting now. And once again, good morning to everybody. Thank you so much to everyone who has joined us. Today we have our outstanding speaker. We have Dr. Eric Weiss. Today is going to be the meeting of the Erics because my name is Erica and it's so nice to see everybody once again. Dr. Weiss, he is a cardiothoracic surgeon. He has obtained his medical degree. He got his medical degree from Johns Hopkins University School of Medicine in Baltimore. He also completed his residency at Johns Hopkins. He completed cardiothoracic surgery fellowship at the New York Presbyterian Hospital at Columbia College of Physicians. And he also completed further advanced fellowships in heart transplantation and mechanical circulatory support at the New York Presbyterian Hospital in advanced aortic surgery at the University of Pennsylvania as well. Once again, thank you so much for joining us, Dr. Weiss.
Well, thank you. It's my pleasure to be here.
Thank you so much for joining us, Dr. Weiss. How are you doing today?
I'm good. I'm on call, so fingers crossed that that I don't have any emergencies for the rest of the day. But besides that, I'm doing very well.
That's great. I'm glad to hear. And so if you don't mind just walking us through a day in your practice, what are days usually like? Either calls or, either on call or off call. What's usually a day like for Dr. Weiss?
Well, so I'm a heart surgeon. I focus pretty much exclusively on open heart procedures. I don't do any general thoracic surgery. My specialty is surgery for aortic aneurysms, and I also specialize in valve surgery. So I do a lot of minimally invasive valve surgery, like minimally invasive valve repairs and replacements through the side, and I also do some transcatheter valve work. So that's sort of the scope of my practice. My typical day is that I usually get into the hospital around 6 in the morning. So I wake up at about, I tend to wake up early. I wake up at about 4 in the morning, sometimes 4:30, because I like to get work done before I start the day. I find that early in the morning is a time that I can do some good thinking. So I like doing writing and speaking. And so early in the morning, that's when I focus on that. I get into the hospital around 6 o'clock, 6:15. I usually have a surgery scheduled for 7 a.m. And then, I do one surgery, then have a break between the surgery. Surgery lasts about 3 hours. I have a break. I see some patients, sometimes in the office. I round on the patients that I've had done surgery on that week. And then I'll have a second surgery in the afternoon. I usually get home around maybe 5 or 6 o'clock in the evening, and I do my exercise workout in the evening because I think that it's easier to do fitness when your brain is fried and you don't want to have to think. So that's when I lift weights and things like that, and then get to bed pretty early. I mean, usually I'm in bed by about 9 o'clock, and so that I can wake up at 4 the next day. So that's kind of the typical day for me as a heart surgeon.
Oh, no, it's pretty nice. Very structured, very, very structured, but very organized. And is a cardiothoracic surgery something you've always wanted to pursue as well, or medicine in general?
So medicine, so I think of the decision to become a heart surgeon and medicine as two separate decisions. So my decision to go into medicine, I joke around that for me, it wasn't really a choice. I feel like from the moment I was little, people around me had been telling me I was going to be a doctor. It didn't matter what I said I wanted to be. They would say, you're going to be a doctor. But then I had a tragic event in my life. My brother died when I was young. And at that point, that was the moment that I decided that I wanted to be one. I had this vision that I wanted to help families that were similar to my own in moments of crisis. So at that point, I decided I wanted to be a doctor, but I didn't have any idea what type of doctor I would be. So my focus early on in my career was really just work as hard as you can, learn as much as you can to try to get into medical school and become a physician. But then in the beginning of medical school, I was really influenced by a preceptor that I was paired with early, who was a surgeon. And I remember he brought me into the heart surgery operating room. And I can remember vividly seeing the heart beating and being amazed by the fact that people, as as a society has figured out how to stop the heart, restart it, and not only would the patient live, but leave the hospital stronger than they were before. And to me, that felt like one of man's great achievements, like walking on the moon for the first time or starting fire. And so I knew that there would be nothing in my life that would compare to being a heart surgeon. And so from that moment, I was totally captivated, and everything fell into place after that in terms of my interest. I mean, every class that I took in medical school, every rotation that I did as a resident, I was the most interested in the ones that had to do with the heart, the physiology, the pathology, and surgery itself.
Mhm. Wow, wow. And so going through your experience, through John Hopkins, I know you mentioned expressing a lot of interest, not only through surgery, thanks to your amazing mentor, but even throughout your studies. If you don't mind me asking, what were some of the other things you involved yourself in throughout your medical education?
Well, I think that, before I was a medical student, I had a lot of extracurricular activities and also volunteer work and things like that to kind of teach me what it was like to be a doctor. So I would volunteer in the hospital. I remember I volunteered in the operating room, just stocking the shelves in neurosurgery cases. So they were doing brain surgery, and I would be kind of stocking the shelves to make sure that they had the supplies they need. I wasn't very good at stocking the shelves because I constantly found myself going over to peek onto the neurosurgery operation to kind of check out what was going on and neglecting my job. But that's sort of a different story. But that's what I did before medical school. Now, once you get into medical school, your focus is really pretty much fully on being a doctor. So I didn't have a lot of extracurricular activities. I mean, in medical school, we would volunteer and, at the middle school in Baltimore, Maryland, and kind of give small lectures to some of the junior high school students at the local junior highs in inner city Baltimore. But beyond that, really my focus was really medicine, trying to become the best doctor I could be. So I feel like when you're on that journey, particularly when you're a resident, you don't have a lot of time for extracurricular activities. You tend to sort of forget those, and then the idea is that at some point in the future you'll get back to them.
Mhm. Got it. So it was more so strong focus in academics, strong focus in the STEP, and just really securing as strong of an application as possible, correct?
Yeah, I always feel that a way to think about your life in terms of the extra things besides your goal is kind of as a pyramid, that everything is balanced. So at the top, you have your goal, whatever you're going after at the time, whether it's medicine, doctor, your business, whatever. And then you also have on the bottom, you have kind of your health and your wellness. So if you have the health over here, that sort of encompasses eating right, having fitness be a part of your life. And then you have wellness. So you need to take time to explore, hobbies and kind of get away from the work and take some time to rest. And if you kind of manage to keep all of those things in that type of pyramid where you focus on all the aspects, I always feel that puts your life in sort of balance. So I've always tried to do that. I mean, no matter how busy I've been, I've always tried to find time for fitness, to stay in shape, and to make sure that that I was able to work out and exercise, because that provides you some calmness and some serenity when you're working very hard.
Mm-hmm. No, definitely. And exercise is something I enjoy doing as well. I know for my rotations, I would do my best to integrate them, especially when I was doing the surgery rotation. So it's good to, maintain a good mind space, a good headspace, especially when it comes to the demands of one's schedule. I noticed you also completed a master in public health. Is that correct? And was
I
this
did.
before medical school or after?
No, I did that during my general surgery residency. So I went to general surgery residency at Johns Hopkins, and part of that curriculum is that they like you to do some research in between at some point during your general surgery residency. So I completed 3 clinical years, and then I did time in the lab. And the laboratory I worked in was a cardiac surgery laboratory. We really focused on studying a couple of things. One was clinical outcomes research related to heart transplantation and lung transplantation. And then we also focused a lot on hypothermic circulatory arrest, which is a technique that's used to treat patients who have aortic aneurysms. And so that was the focus of the lab. One of the things that I wanted to get out of my time in the lab was learn how to become a great clinical researcher. So in the 3 years that I did in the lab, one of those years was devoted to getting a Master's of Public Health degree, and I was able to get that from Johns Hopkins, which was a great experience. I think it has helped me be a better doctor, because when you understand issues that are involved in public health, you understand, it just gives you a broader appreciation of what is kind of the microcosm of surgery, so that you're a more complete physician in general.
Definitely. And would you encourage students to possibly pursue a Master's of Public Health either before residency or during residency, like you mentioned, to supplement their practice?
Well, I think if you have that interest, the Master of Public Health is somewhat of a catch-all degree. I mean, there's all sorts of different majors within public health. So, you have biostatistics and epidemiology, but you also have environmental health, and you have, just it runs the gamut of many things in public health. So if people have that interest, then I do encourage it, because it's only a year, and you can spend a year of your life getting that degree. But if you don't think you're going to use it, then there's probably not much benefit. For me, I wanted to have an appreciation and an understanding of clinical research, statistics, methodology. So for me, it made sense. It doesn't make sense for everybody.
Mm-hmm. I understand. And so you would say that's essentially where your research journey started?
Yeah, so I published, when I was in the lab at Johns Hopkins, I did a lot of research. I published, something like 70 or 80 papers in peer-reviewed journals, and I was able to give, 60 or 70 talks at national meetings, and that was a really good experience for a resident, because you gain confidence being on stage, presenting your findings, speaking to other physicians about your research, and you really gain that comfort level on some of the biggest stages. So I think that helps you in general in life. I don't do as much research anymore. Now, most of what I'm focused on is clinical work and other things. But it was a nice part of my life to be involved in research when I was in training.
No, definitely, of course. And the reason I ask is also because a lot of the individuals here in the audience, a great focus of ours is, we're currently either medical students or medical graduates, just really individuals who are going through medical school or in that transitional state towards residency. And so the biggest focus for people in the stage, and I'm sure you can recall, so when you were at that time, is ways to really find themselves either in research or using that as a way to supplement, again, their residency prospects.
Yeah, I think that when you're in medical school and you're applying for a specialty, you're kind of putting together the story of who you are, because it's very difficult to differentiate yourself from everybody. There's so many people who want to be physicians and want to be in that specialty, and you have to find a way to differentiate yourself. So I always think of this like you're crafting your story, and what is going to make your story interesting? If someone was reading about it in a book, what would they like to read? And sometimes I think when people get into trouble, it's because they're too haphazard. They are. And by the way, this my opinion is informed by the fact that I was on the admission committee for Johns Hopkins. We had a students members of the admissions committee, so I served on the admissions committee, so I know what they looked for. And I also was involved in the admissions in my residency and fellowship. So I know that some of the people who get into trouble are too haphazard. They have split focus in many different areas. They're doing research and community service, and they're helping this, and they also are, have this other project, and they have their schoolwork, and very hard to differentiate that applicant. Very hard to know what they're about, what they're interested in. But the person who has a clear focus, they want to be a neurologist, and they did research for 3 or 4 years in Parkinson's disease. And their family member had Parkinson's, and that's what inspired them to go into that field. That's a person who has a clear story, and that's very attractive for anybody in admissions. It's a good story. You like it. It's easy to listen. It would be, you could read about it in a book and it would make sense. So I think that's the way I think about extracurricular activities. They need to be sort of part of your overall story that you're crafting for the people who are on the admissions committee, because that's what's going to differentiate you from the many, many people who are applying.
Definitely. And were there any standout students that you recall from your time as an individual in the admissions committees? Was there a specific either individual or again an instance that just made you say yes?
Absolutely. I mean, there are many, many outstanding people. I think that to some extent it's less about the grades and the test score, as long as you meet a certain threshold, because there's going to be many, many people who have straight A's and who have excellent test scores and are very smart. And if you try to distinguish yourself based on that, it's very hard, because it's like trying to be the richest person in the world. There's always someone richer. If you're trying to be the person who has the best grades and the best test scores, there's going to be someone who has better grades and better test scores. But I think the people who really stood out to me were the ones who had that something intangible, something extra, some passion that they had, that it was clear that they were passionate about. They had spent their time pursuing it. They had pursued it with vigor, with intensity, and for a long period of time. Those were the ones that really stood out to me.
Wow. So as you mentioned, using all of those components to create that vision. And so for individuals who, again, are looking to have research, or research is part of their vision, what are some recommendations you might have for those who are looking to, again, research is part of their vision, they're very research focused, but sometimes there are challenges when it comes to either application or not knowing who to go to, how to just really navigate that whole venture. What are some recommendations you might have on that, Dr. Rice?
Sure. So I think that, one, research is important. I mean, because it shows that you're able to complete something. Getting a paper published is hard. I mean, you have to start with the idea, you have to do the work, you have to see it through, you have to write a paper, submit the paper will come back with edits or critiques. You'll have to respond to those. And so, the act of publishing a paper is difficult. Now, it gets easier each one you do. So that's the good news. But the bad news is that, at least for that first one, very difficult. And I think people do like to see that people have done research, because it shows that you can focus, you can commit to something like that. So your question was, how do you be successful in that process? Particularly if you're starting from having not done a lot of research, or you don't have expertise. I think the first thing is you want to make sure you get a good mentor. I mean, and this is very important. You're going to have to do research with someone who's going to be your advisor or your mentor, because as a student, you're not going to be able to just publish on your own. You're going to need the backing of a faculty member, or someone who is who has the clout behind them of the organization. So you want to choose that person very carefully, and you want to make sure that they have time for you. You don't necessarily want the most famous person or the busiest person, because they may be so busy that they don't have time to share ideas with you and to meet for coffee or whatever. I've had some of my most successful research with people who were just starting. They were up and coming, and they had ideas, but they were busy clinically. They didn't have the time to put their ideas to an actual study. I had a lot of success with people like that, because I was able to do the work. They had time for me to really bat those ideas back and forth. And I felt like in those cases, we were successful getting the papers published. Whereas I always felt like when I worked with the most famous person, you get something out of them too, because obviously when you do get their attention, you're going to get some phenomenal idea because they're so experienced, but you're not going to have their attention for very long. So maybe a combination of mentors, maybe it's the person who's famous and the person who is a little bit more up and coming is a good way to think. But clearly mentorship is important. I think as you learn about the subject that you are researching, you're going to have your own ideas, and you shouldn't be afraid to explore them. Because just because you're new doesn't mean you don't have a great idea that you haven't thought about in a different way or in a way that someone else hasn't thought about. There were studies that I conducted and published that were based totally on my idea. No one gave me the idea. And if I had been afraid to speak up or to give that a shot, those ideas might not have ever turned into anything. So I think those are two pieces of advice I would give for people who want to start out with research.
Well, that's definitely excellent advice. I think it's amazing. And something as simple as even pitching it out to your, preceptors or just individuals around in your rotations, correct?
Totally. I think that it never hurts to have more feedback, more ideas, because when you talk to people, your brain is going to be turning as you hear all the different ideas that are batted back and forth. So I think bouncing ideas off a few people is always a good idea.
Mm-hmm. No, that's excellent. Oh, and I appreciate that because, I mean, for example, me going through my rotations, particularly surgery, you're exposed to so many different things, and you do the literature, but nonetheless, you do see some novel situations, and ideas just begin to run. And so, definitely, if a conference is not in the near future, again, perhaps recommending it to a professor, and then from then, the possibility of presenting it as a conference or so forth, I think could be a good approach.
And don't forget that the best ideas in anything, I mean, not just medicine, but business, often come from a hybrid of different approaches. So, things that were done in other areas applied to a new area or in a new way are often one of the most successful inventions or research studies or applications. So that's why it's important to get a range of opinions, because you might learn something in plastic surgery that can inform what you think about in rheumatology, and you didn't really put that connection together because you never thought about it that way. But you never know when those types of ideas strike.
Did you ever have any instances like those during your rotations, where maybe something from one rotation applied to another?
I've had that. I'm trying to think of a specific example. I mean, we've utilized one of the things that I did. I mean, this is not a very this is not a novel concept, but I did notice when I was working in solid organ transplant that they would harvest the UNOS database for lots of studies, and for some reason, no one was really harvesting the UNOS database in cardiac surgery, even though in our organization, even though the database was robust. And I think that transplant in heart surgery is sometimes it's just an extra thing. It's not the only thing that heart surgeons are doing, so they don't think about it in the same way that the dedicated transplant surgeons do. So we brought the UNOS database to the cardiac surgery research lab, and that probably produced in the hundreds of papers from the lab just by utilizing something that I saw that they were doing in solid organ transplant, and we brought it to cardiac surgery. So that's not a novel, that wasn't a novel use of something, but it is an example of a time when I noticed something in a different area that we would then apply to our area, and it was successful.
No, definitely. Wow. And all just from asking why or how.
Yeah, exactly.
Mm-hmm.
And that's kind of the essence. That's the essence of research, to ask how. I mean, that's what makes a great researcher.
Mm-hmm. No, definitely. And regarding research and just coming up with those questions, I do believe you do focus on minimally invasive techniques for heart surgeries. Is that correct?
Yes.
Is that would you mind elaborating a little bit more on just particularly on what you do the impact you have on your patients, their recovery, and so forth, because I do believe there have been, not that there was a different protocol prior, but minimally invasive, I'm not sure if it's, something we're leaning towards as well.
Right. So one of my passions is always improving things. I always when you talk about surgery specifically, I'm always thinking, how do we do it better, faster, more efficiently, better outcome. That's just kind of part of my makeup as a surgeon. I'm always kind of questioning the status quo, thinking, how can we do it better or faster? I've done that with minimally invasive valve surgery. So in my practice, when I joined the practice 11 years ago, there was no one in the region doing complex minimally invasive valve surgery. And by minimally invasive valve surgery, I mean, instead of doing the traditional open heart sternotomy valve repair or replacement, we can repair and we can replace valves through the side, either a small incision here in the upper chest or an incision here in this side. That has a huge advantage for patients because, number one, they're in the hospital for a shorter period of time. Two, they recover much faster. They get back to their kind of full function within about 4 to 6 weeks instead of about 3 months, like it would be with the traditional open heart surgery. Three, they have less bleeding. They also have less infection. They have less pain. So huge advantages to being able to perform heart surgery in a minimally invasive way. So I started the minimally invasive valve program at our organization maybe about 8 to 9 years ago. And now it is the most robust minimally invasive valve program in Wisconsin, or really in the region. And we've helped a lot of patients. I mean, by bringing that approach, a lot of patients have had richer, fuller, more satisfying lives because they were able to get a minimally invasive approach. Now, it's not for everybody. There are clearly many patients that we still have to do open sternotomy on. But whenever possible, I try to do surgery minimally invasive. The other aspect of minimally invasive is the transcatheter valve. So that's become a big deal in heart surgery over the past 10 to 15 years. And we have, whenever possible, particularly for older patients or for high-risk patients, we try to replace valves through the groin so they don't even need any type of surgery, not even minimally invasive or open heart surgery, but really sort of a non-surgical approach or a catheter-based approach. So that's what we do. We're the biggest valve center in the region, and I think that it comes from always trying to push the envelope a little further, question how can we do it better, and that's been what I've done throughout my whole career.
Again, going back to that initial why or how, just that inquisitive. Mm-hmm.
Yeah, I think if you just accept the status quo and you say, well, I'm just going to, it's a continuum. So when you start out as a surgeon, you're going to do things as the way your mentor did. You're going to just kind of pattern yourself after the way you see things, because you don't want to be, when you're first learning, you don't want to be inventive and push the envelope. You have to learn the basics first. But as you get experienced and as you get better, and in your future part of your career, you're going to really learn that maybe you should challenge that status quo. Maybe you need to do things a little bit differently. And that's when that really leads to the real innovation, when you've taken that patterning that you've done and then learn how to expand it.
Definitely. And when it came to developing the method, did you experience any challenges throughout the course of the development, or maybe people having doubts or any of the like?
Yeah, there's always going to be challenges. I mean, anytime you try something new, you're not good at it yet. And so there are going to be times where things didn't work out as well as you wanted it to. Both minor and significant problems. I think the key in surgery, in medicine in general, and really in life, is that you never want to make the same mistake twice. So that's what I always say to myself, that it's fine to make a mistake. And in fact, you're going to make plenty of mistakes. Even with the best intentions, we all make mistakes. There's no way to avoid it. But what you really want to try to avoid is making the same mistake twice. And the way you avoid that is by taking careful time to analyze your mistake, learn from it, go back, figure out what went wrong, what went right, what could you have done better. That's what I do almost after every single surgery, just to constantly do that check-in of how did this go, how could we have done it better? Because that way you avoid making the same mistake over and over again. And I would say that when you're trying something very new, when you're starting with an absolute new technique, you do want to have good outcomes. So you don't want to be, because if you have bad outcomes in the beginning, people are going to really question the technique. And there may have not have been anything wrong with the technique, but maybe you just didn't think it through well enough. And so it led to a bad outcome. So you really want to pay, I think in the beginning of trying something new, you have to pay really close attention to making sure that you're gonna do it perfectly.
I understand. Yes. And this also emphasizes, like you mentioned, speaking it over with colleagues from different backgrounds, from different education levels and so forth. That way we can ensure that's centrally prevented, correct?
Yeah, learning from others is the way to make sure that you're not missing something you didn't even know about. We all have kind of gaps in our ability and in our knowledge, and those gaps always fall into categories. And sometimes they're knowledge gaps that you just didn't know about, but oftentimes they are experience gaps where you haven't had the experience yet, and you wouldn't have even thought to think about it because you never had the experience. So mentorship plays a big role in that, because a mentor or an advisor or someone who's been there before can show you where the landmines are so you don't step on them, and you might not have even known you were walking through a minefield.